Hi, I'm Stephanie Booth. I'm an Augustana alumna and an epidemiologist. You might be more familiar with the term epidemiology because of the COVID-19 pandemic. Essentially, what we do is study the spread of disease in populations and try and understand who different diseases impact. It's a part of the larger field of public health, which is concerned about the health of populations. My personal background is that I got a Bachelor of Science in Biology from Augustana in 2014, and then a master's degree in Public Health from the University of Alberta in 2017, specializing in epidemiology. My career has included a number of different positions, including in policy analysis at the Government of Alberta, as a researcher in vaccine epidemiology at the University of Calgary, doing research and evaluation at a police service, and most currently working at the Public Health Agency of Canada as an epidemiologist, focusing on the training and development of other epidemiologists and public health professionals. I'm very lucky that I went to Augustana because my liberal arts education definitely gave me an advantage when it comes to epidemiology because I'm more easily able to see how concepts like biology and sociology and economics all kind of fit into a larger picture together when I try and look at diseases. 3 tips that I'd have for those interested in going into the field of epidemiology would be, first of all, to know that there isn't one right way to be an epidemiologist, especially with your training and background. There are doctors and nurses and PhDs and people with Masters of Science and Masters of Public Health who work as epidemiologists, as well as people who have bachelor's degrees but are in the right job at the right time. So consider what openings are available, especially right now with the COVID pandemic. There's tons of opportunities in public health. So look into those and then also maybe consider graduate school. The second tip I'd have is that public health in general and epidemiology are really broad fields. They're not just about infectious disease. They're also looking at chronic diseases like diabetes and cancer, maternal health, child health, education, nutrition. It's a super broad field, so I'd say look into what your interests might be before trying to figure out where you might fit into that puzzle. And the third thing I'd say is that epidemiology is not like it is in the movies or on TV. It isn't always that exciting. A lot of our time is spent behind a computer analyzing data and looking at data and coding and working under really tight timelines. So it's not always glamorous, but it is always rewarding. So if you think that's right for you, it might be a good field. Now, if you have questions on going into graduate school for a non-thesis program like I did, or working for government, or what it's like being an epidemiologist during a pandemic, feel free to ask me a question.